Understanding arthritis. Arthritis is a prevalent and potentially debilitating condition that affects millions of people worldwide. It is not a single disease but rather an umbrella term encompassing a group of more than 100 disorders that involve joint inflammation. In this comprehensive video, we will delve into the various aspects of arthritis, including its symptoms, types, causes, diagnosis, and diet. Types of arthritis. Osteoarthritis, OA. Most common form of arthritis. Occurs when the protective cartilage that cushions the ends of bones wears down over time. Commonly affects weight-bearing joints like the knees, hips, and spine. Rheumatoid arthritis, RA. An autoimmune disorder where the immune system attacks the synovium, lining of the membrane surrounding the joints. Results in inflammation that can damage joints, cartilage, and even the bones themselves. Psoriatic arthritis. Occurs in some people with psoriasis, a skin condition. Can affect any joint and may also cause inflammation of the spine, spondylitis. Gout. Caused by the buildup of uric acid crystals in the joints. Often affects the big toe but can also impact other joints. Ankylosing spondylitis. A type of arthritis that affects the spine, causing inflammation between the vertebrae. Symptoms of arthritis. Joint pain. Persistent discomfort or aching in one or more joints. Swelling. Inflammation and swelling around the affected joints. Stiffness. Reduced range of motion and stiffness, especially in the morning or after periods of inactivity. Redness and warmth. Joints may appear red and feel warm to the touch. Fatigue. Generalized tiredness and lack of energy. Causes and risk factors. Genetics. Family history of arthritis may increase the risk. Age. The risk of arthritis increases with age. Gender. Certain types of arthritis, such as RA, are more common in women. Joint injuries. Previous joint injuries may contribute to the development of arthritis. Autoimmune factors. Conditions where the immune system mistakenly attacks the body's own tissues. Diagnosis. Medical history. Detailed discussion of symptoms, family history, and lifestyle factors. Physical examination. Examination of joints for swelling, redness, and range of motion. Imaging tests. X-rays, MRIs, and CT scans to visualize joint damage. Blood tests. Blood tests to identify markers of inflammation and autoimmune activity. Medications. Research and future directions. Advancements in drug development. Ongoing research is focused on the development of novel medications with improved efficacy and fewer side effects. Biologic drugs targeting specific components of the immune system. Show promise in treating autoimmune forms of arthritis. Precision medicine. Tailoring treatment plans based on an individual's genetic makeup and specific characteristics of their arthritis. Personalized medicine aims to enhance treatment outcomes and reduce adverse effects. Regenerative medicine. Investigating the potential of regenerative therapies, such as stem cell treatments, to repair damaged joints and tissues. These innovative approaches hold promise for slowing or even reversing joint degeneration. Patient-centric approaches. Integrating patient preferences and experiences into treatment plans. Empowering individuals with arthritis through shared decision-making and personalized care. Tips for arthritis management. Maintain a healthy lifestyle. Adopt a balanced diet rich in anti-inflammatory foods, such as fruits, vegetables, and omega-3 fatty acids. Regular exercise can help manage weight, improve joint flexibility, and reduce pain. Stay informed. Keep abreast of the latest developments in arthritis research and treatment options. Educate yourself about your specific type of arthritis to make informed decisions about your care. Listen to your body. Pay attention to your body's signals and adjust activities accordingly. Don't push yourself too hard during periods of increased pain or inflammation. Build a support network. Connect with others facing similar challenges through support groups or online communities. Share your experiences and learn from others who have found effective coping strategies. Regular health checkups. Schedule regular appointments with your healthcare provider to monitor your arthritis and adjust your treatment plan as needed. Arthritis is a complex and varied condition that impacts individuals in unique ways. While there is no cure, advancements in research and treatment offer hope for improved outcomes and enhanced quality of life. With a multifaceted approach that includes medication, lifestyle modifications, and emotional well-being, individuals with arthritis can actively manage their condition and strive for a fulfilling life. As we continue to unravel the mysteries of arthritis through research and innovation, the future holds promise for more effective treatments and, ultimately, a better understanding of how to prevent and manage this challenging condition. Until then, the collaborative efforts of healthcare professionals, researchers, and individuals living with arthritis remain crucial in navigating the journey towards improved arthritis management and, eventually, a cure. A well-balanced and nutritious diet plays a crucial role in managing arthritis symptoms and promoting overall joint health. While there's no specific arthritis diet, certain foods may help reduce inflammation and alleviate symptoms, while others may exacerbate joint pain. Here's a general guide on foods to include and avoid in an arthritis-friendly diet. Foods to include: fatty fish. Salmon, mackerel, trout, and other fatty fish are rich in omega-3 fatty acids, which have anti-inflammatory properties. Nuts and seeds. Walnuts, flax seeds, chia seeds, and hemp seeds contain omega-3s and can be beneficial for joint health. Colorful fruits and vegetables. Berries, cherries, oranges, spinach, kale, and other brightly colored fruits and vegetables are high in antioxidants and may help reduce inflammation. Whole grains. Brown rice, quinoa, oats, and whole wheat provide fiber and essential nutrients without promoting inflammation. Olive oil. Extra virgin olive oil contains monounsaturated fats and antioxidants that may help reduce inflammation. Turmeric. The active compound in turmeric, curcumin, has anti-inflammatory properties. Consider adding turmeric to your dishes or taking supplements. Green tea. Green tea is rich in polyphenols, which may have anti-inflammatory effects. Broccoli and Brussels sprouts. Cruciferous vegetables are high in vitamins, minerals, and antioxidants that support joint health. Low-fat dairy. Low-fat or fat-free yogurt, milk, and cheese provide calcium and vitamin D for bone health. Ginger. Ginger has anti-inflammatory properties and can be added to teas or used in cooking. Foods to limit or avoid. Processed foods. Highly processed foods, including those with added sugars and unhealthy fats, may contribute to inflammation. Red meat. Limit the consumption of red meat, as it may contain pro-inflammatory compounds. Choose lean cuts or alternative protein sources like fish or plant-based options. Fried foods. Foods high in trans fats, often found in fried and processed snacks, may contribute to inflammation. Refined carbohydrates. White bread, pasta, and sugary cereals can lead to inflammation. Opt for whole grains instead. Sugary drinks. High sugar beverages may contribute to weight gain and inflammation. Choose water, herbal tea, or infused water instead. Alcohol. Excessive alcohol consumption can contribute to inflammation and may interact negatively with some arthritis medications. Dairy, in some cases. Some people with arthritis may be sensitive to dairy. Pay attention to your body's response and consider alternatives if needed. Nightshade vegetables, in some cases. Some individuals report increased joint pain with nightshade vegetables like tomatoes, peppers, and eggplants. Monitor your personal response to these foods. Tips for an arthritis-friendly diet. Maintain a healthy weight. Excess weight puts additional stress on joints. A balanced diet and regular exercise can help manage weight. Stay hydrated. Proper hydration supports overall health, including joint function. Consider dietary supplements. Consult with a healthcare professional about supplements like omega-3 fatty acids, vitamin D, and glucosamine, which may support joint health. Listen to your body. Pay attention to how your body reacts to certain foods and adjust your diet accordingly. Remember that individual responses to foods can vary. It's essential to work with a healthcare professional or a registered dietitian to tailor dietary recommendations to your specific needs and health conditions.